and welcome to our special show, Save a Life. I'm Priyanshi Sharma. When it comes to heart diseases in India, the statistics speak volumes. In the last 2 decades, heart disease has become the leading cause of death in the country, with a quarter of all deaths due to various cardiovascular diseases. Even worse is the fact that the disease hits us Indians in our most productive middle years. In almost every family, we have at least one family member with a heart disease. Improved awareness may lead to early recognition of CVD symptoms and their risk factors and make patients aware of the importance of regular checks, even if they are healthy. Also, most of cardiac arrests are sudden and on the spot. It is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Now, raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPRs in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR and highlight the role of CPR in saving a life. It's time we take our heart health into our own hands and progress to become healthier people. Today we have with us eminent cardiologists who can help us all understand sudden cardiac deaths and the role of CPR to revive and save a life. I welcome all our guests joining us. Dr. Sunanda Priyadarshini Mohanty, who is a consultant interventional cardiologist at Amit Institute of Medical Science and Hospital in Behrampur. We also have Dr. Ashar Khan, a consultant interventional cardiologist at Healthy Heart Clinic in Nagpur. And we also have Dr. Amit Sinkar, a consultant interventional cardiologist at Sinkar Cardiac Center in Pune. Thanks very much, doctors, for joining us on this special discussion. And Dr. Sinkar, if I can first start with you. It's easy to think that all symptoms or signs of heart disease are obvious. But sometimes the first indication of heart disease is a heart attack. What are some heart disease symptoms that people often ignore?
A very good afternoon to all the NDTV viewers. I agree with you, ma'am, that it's a myth that if we think that if we do not have any typical symptoms of chest pain or breathlessness, that means we may not be suffering from any heart disease. But to tell the truth, heart disease can vary from a silent symptom to a heart attack or a sudden cardiac arrest at the first symptom. But at the same time, there could be some atypical symptoms which we tend to ignore and should not be ignored. And the typical characteristic of any heart disease is heaviness or tightness, and the site may not be always the center of the chest or left side of the chest. This particular discomfort can happen even on the right side of the chest, sometimes mid-back, both the upper limbs, or sometimes even a jaw pain can also be a characteristic of heart symptom. Not only that, sometimes symptoms like acidity, bloating, gases, heartburn, feeling of fast and irregular heartbeat or giddiness, extreme tiredness, fatigue, or such symptoms can also be pointers towards heart disease. If someone is getting any kind of symptom, probably they need to consult their doctors as early as possible.
Right, of course, those symptoms are important for all of us to note. And Dr. Khan, it is said that angina is also a symptom that's caused by coronary heart disease. So what is angina and what causes it?
Good afternoon to all viewers. So angina is a classical symptom of heart disease and it has been known since the ancient time. Sushruta, the great Indian physician, described angina as Ritashola. It means like feeling a dagger in the heart. So in layman terms, angina is a type of chest discomfort or chest pain that occurs when the heart muscle is deprived of oxygen-rich blood through the coronary arteries. It is typically described as a squeezing pressure or heaviness in the chest. However, some patients can actually experience this pain in the arms, in the neck, in the jaw, or in the shoulders. So the most common cause of angina is coronary artery disease, and angina is caused by narrowing or blockages in one or more coronary artery disease, which is supplying the oxygen-rich blood to the muscle of the heart. So Priyanshi, it is very important to know who are at risk for developing angina. It is important to note that patients who are smokers, who have a lot of stress in their life, people who have high blood pressure, high blood cholesterol, diabetes are very high risk for developing angina. At the same time, people who have a very strong family history of heart disease in their family should be careful about the development of angina and should meet their doctors regularly.
Right, and while we're talking about angina, Dr. Mohanty, how can a person differentiate the pain of angina from a heart attack?
Okay, good afternoon, everyone. So basically, when we say angina, we mean a symptom complex. So it is basically something which the patient describes as tightness in chest, difficulty in breathing, and these symptoms are mostly exertional and they decline with resting. So it is not actually a grave medical emergency. It happens due to slowly growing atherosclerotic plaques that develop in the vessels of the patients. So on the other hand, when we speak of heart attack, it is an absolute medical emergency and it occurs due to abrupt and complete closure of the arteries of the heart. So the symptoms are more severe, they are persistent, and the medical always absolutely needs immediate medical attention and simple investigations like ECG, blood troponin levels. They can help to diagnose the condition, and most often patients with heart attack will need immediate intervention, whereas patients of angina can be managed well enough with medical therapy.
Right, and my next question to you, Dr. Singhkar, clogged arteries can lead to heart attack and stroke as well. So can high blood pressure indicate blocked arteries?
High blood pressure directly does not indicate clogged arteries, but high blood pressure is definitely a risk factor for developing blockages in the blood vessels. Basically, high blood pressure causes increase in resistance in the blood vessels that causes damage to the inner lining of the blood vessels. And that creates a venue for whatever bad fats are running through the blood. They tend to accumulate over these damaged blood vessels, followed by accumulation of certain blood cells called as platelets, which lead to blockages in the blood vessels. So blood pressure is definitely a strong risk factor which should be controlled to prevent any kind of blockages in the heart blood vessels.
Right, and let's now talk about another disorder that is linked with heart diseases often. Dr. Khan, sleep apnea is a potentially serious sleep disorder. So is there any link between sleep apnea and heart disease? And how can someone prevent a heart disease if he or she is suffering from sleep apnea already?
Yes, Priyanshi, there is a very strong link between sleep apnea and heart disease. So sleep apnea is a disorder in which a patient's breathing gets interrupted repeatedly during the night time. This results in drop in oxygen levels and frequent nighttime awakening. This can lead to multiple health problems such as high blood pressure, heart disease, as well as stroke. So during episodes of sleep apnea, the patient's oxygen level drops, and this results in a lot of stress to the cardiovascular system of the body. As this stress keeps on accumulating over a period of time, this causes a lot of functional damage to the functioning of the heart as well as that of the blood vessels. So patients with sleep apnea also tend to have other risk factors for heart disease such as obesity, diabetes, and high blood pressure. So when we talk about treatment of sleep apnea, the most important thing is lifestyle changes by a patient. It is very important to reduce their weight. It is very important to forego smoking. It is very important to avoid alcohol and sedatives before nighttime. CPAP, that is continuous positive airway pressure, is a method that is used to treat sleep apnea. It is a method by which a mask is used to provide a continuous stream of air throughout the night, which prevents the collapse of airway and prevents the drop in oxygen and the further detrimental effects of that. So besides that, some people may actually require surgery to correct the physical obstruction to respiration to prevent apnea spells. It is also very important for patients with sleep apnea to manage other risk factors which put them at high risk for heart disease, like high blood pressure, high cholesterol, and diabetes. This may involve making dietary changes, enrolling themselves into a weight loss or exercise program, and taking their medications regularly as prescribed by their doctor. So by managing sleep apnea and the risk factors that predispose them for heart disease, patients with sleep apnea can actually prevent the risk of developing serious cardiovascular problems.
Right. Right, and while we've talked about sleep apnea, Dr. Mohanty, if we shift our focus now to what happens if you have an abnormal heart rhythm, what is the most common serious heart rhythm abnormality?
Speaking about the normal heart rate of an individual varies between 60 to 100 beats per minute. Now we have two groups of arrhythmias that can occur. One is when the heart rate is less than normal, which we describe as bradyarrhythmias, and the other group is tachyarrhythmias. Both of them can generally present with palpitations, loss of consciousness, and fatigue. All these conditions can generally be diagnosed well enough with ECG or tests like Holter test, electrophysiological studies, etc. Now, these conditions can be present in a person from birth, or these can be acquired. And speaking of the most common arrhythmia that we see worldwide, atrial fibrillation is the most common arrhythmia seen worldwide, and it is associated with an irregular heart rate. The heart rate goes very high, and most patients they present with palpitation, shortness of breath, and fatigue. But the interesting thing about atrial fibrillation is that sometimes it may not be diagnosed, like it can be an incidental finding in most patients. Only a simple ECG can reveal that the patient has atrial fibrillation. And the incidence is very high with increasing age of the population, with most of the cardiovascular morbidities which are being well managed these days. Slowly the incidence is also increasing.
Right, and as we discussed that an abnormal heart rhythm is dangerous. So Dr. Singhkar, which abnormal heart rhythm can cause sudden cardiac arrest and how?
Out of all the abnormal rhythms, ventricular fibrillation is the most dangerous, and it can lead to immediate loss of consciousness and can cause cardiac arrest. So that's where the importance of CPR lies. If someone detects a patient to be unconscious and if ventricular fibrillation has been found, then CPR has to be given immediately. So all individuals should be trained in CPR, and if available, an AED machine which can deliver an immediate shock should be utilized. So I would recommend all of the viewers to understand how to do basic CPR in case of any unconscious patient. And as the theme says, that we should take the heart health in our hands and be a responsible citizen. Our initiative can definitely save someone's life. So save a life by understanding how to deliver basic CPR.
Right. We'll pause for a short break now, but we'll return with more of these important questions with our doctors. Stay tuned. Welcome back to our special discussion in which we're focusing on cardiac arrest and means of treatment and revival. We are joined by eminent cardiologists. And Dr. Khan, if I can come to you with this question. Cardiac arrest and heart attack are now commonly seen in young people. So can CPR help to reduce the fatality rate in this? And what exactly is CPR?
So yes, Priyanshi, cardiac arrest and heart attacks are serious medical conditions that can affect all ages. So initially there was a misconception that heart disease tend to occur only in older ages. However, over the last few years, particularly with a few high-profile examples like that of actor Siddharth Shukla and Christian Eriksen during the Euros, we have seen that even young patients are susceptible to cardiac arrest and heart attacks. So in the event of a cardiac arrest or a heart attack, as Dr. Singhkar has said, performing CPR can be a life-saving intervention that can help reduce the fatality. So CPR stands for cardiopulmonary resuscitation. It is a technique that is used to maintain blood flow and oxygenation to the body when the heart has stopped beating or is pumping ineffectively. CPR involves a combination of chest compression and rescue breaths that are administered by an individual. So during CPR, the chest compression helps to circulate blood throughout the body and preserve the vitality of the important organs such as brain and heart. And the rescue breaths provides oxygen to the lung. So the goal of CPR is to sustain these vital organs until medical help arrives. The beauty of CPR is that even a normal person can give CPR, and timely CPR can reduce the fatality rate by more than 2 to 3 times. So it is very important that the general public is educated about CPR. Also, as Dr. Singhkar has said, automated external defibrillators, which are now freely available at airports, railway stations and metro, people should be trained to use them and trained to use them confidently so that every person can actually become a lifesaver.
Right, so CPR really can save somebody's life, and that's important to note for all of us. And Dr. Mohanty, when should one stop doing CPR on a person?
Okay, that's a very good question. More relevantly, let's make it more relevant for the viewers because statistically speaking, more than 80% of the cardiac arrests they occur outside the hospital setup. So it is important for a normal individual to understand when to start and stop CPR. So once CPR is initiated in a person who is unconscious or has had suffered a cardiac arrest, we need to push hard and push fast in the center of the chest for at least 2 minutes. And in between, the patient needs to be assessed repeatedly. So, how do we find out if the patient needs, like, we have to stop CPR? Is basically we look for signs of return of spontaneous circulation, like there is a return in the pulse, the patient is conscious, starts breathing spontaneously, and then these are the points which can help us to decide whether to stop or continue CPR. Now, basically, if the patient is not recovered, so we need to continue CPR for at least for the time till the medical help arrives. CPR should be continued in rounds of 2 minutes, and there should be exchange of hands between two operators so that the quality of CPR given to the patient is maintained without fatiguing the operator. And it is also important to understand that certain conditions like patients who have chronic conditions, chronic heart diseases, chronic kidney patients, or malignancy patients, where the chances of recovery of the cases is very less, and CPR most of the time is futile in these cases. CPR can be stopped after a trial of 20 minutes.
Right, and while we're talking about CPR as a means of revival, let's also talk about another point of concern, Dr. Singhkar. Does cholesterol accumulate right from an early age, and do people have to worry about it only after they are above 30 years of age or earlier?
Nowadays, childhood obesity is becoming a major problem. So we tend to look at the healthy and chubby babies as normal. But unfortunately, this childhood obesity turns into a major metabolic syndrome as they progress into their adulthood. So the deposition of cholesterol blockages starts right from early age. Fortunately, it takes few years for clinical events to happen. But there are ways to understand whether these blockages or cholesterol deposits have already started. And the most important or the basic blood test, that's lipid profile, can tell us about the elevations of cholesterol in our body, especially in cases of familial hyperlipidemia, where there is a genetic or a familial tendency to have high blood cholesterol levels, can be detected at a very early age. And if it is found to be high, then early appropriate treatment can help in controlling these cholesterol levels, obviously preventing future blockages. So check your lipid profile regularly, and if there is obesity problem, then do consult your doctor who can help you in understanding the causes of obesity, understanding the reasons for metabolic syndrome. Also in younger age, smoking and lack of physical activity are also responsible for development of blockages in the arteries. So having a good lifestyle by way of appropriate diet, regular exercise, stopping smoking and alcohol consumption, and consulting your doctor on a regular basis, checking your lipid profile would help us in understanding the reasons for blockages as well as preventing them at an early stage.
Right, of course. So those regular tests are also important to find out the problem just in time. And Dr. Khan, many people are unaware of the importance of medical and medication adherence. Could you please explain what medical adherence is and why is it critical for people with chronic illnesses?
So yeah, medical adherence, or also known as compliance, is critical, particularly when we are treating chronic patients like those who have blockages, like those who have blood pressure, those who have heart failure. So it refers to a patient's ability to follow the prescribed treatment plan and take their medications as directed by the doctor. This includes taking the correct medication at the correct dose at the correct time, following the instructions which are to be followed while taking the medications, and avoiding certain food stuff, and overall following the treatment plan that has been prescribed by the doctor. So particularly in chronic cardiac illnesses such as high blood pressure, such as heart failure, it is critical that the patient is compliant and is following the treatment plan to the T. These conditions require long-term ongoing treatment with medications to manage symptoms, to prevent complications, and further reduce the risk of cardiac events such as heart attacks and stroke. So, non-adherence to medication can lead to poor control of symptoms, and which in turn can increase the risk of hospitalization, disability, and death. Additionally, if the patient fails to adhere to the prescribed medication doses, it actually is a major contributor to increasing medication-related side effects, which can further impact the patient's quality of life. Nextly, if we look at the reasons why patients do not take their medications properly, it includes forgetfulness, it includes financial constraints, it includes difficulty in managing complex medicine regimen, and it also includes concern about side effect in the patient. So the doctors and the patient, they need to sit together and find solutions so as to ensure medical compliance and adherence. These include simplifying medication regimen, providing education and support to patients, and involving the family members and caregivers in the treatment plan.
Right.
By improving medicine adherence, patients with chronic cardiac illnesses can improve their overall health, improve their overall quality of life, and can definitely reduce the risk of complications.
Right. And my next question to you, Dr. Mohanty. In a developing country like India, anemia is very common. So is there a link between anemia and heart failure?
Yes, this question is very pertinent to a developing nation like India, where the prevalence of iron deficiency anemia can be as high as 40 to 50% in the high-risk populations like adolescent females, menstruating females, and elderly population. So, anemia is actually a double-edged sword, where we can say it is both the cause and complication of heart failure. In heart failure, we have to understand that at least 7% of patients of this category, like with heart failure, they progress to develop anemia over the years of treatment. So anemia actually worsens the symptoms of heart failure, and it also increases the morbidity and mortality associated with heart failure. On the other hand, anemia can also be a cause for heart failure. It can be a cause of high output heart failure, where the patients can maintain a good cardiac output and still remain in failure. These kind of conditions are generally seen in high risk populations like females, adolescent females, and elderly age groups. Now, we also have to understand the fact that a lot of comorbidities are associated with heart failure, like CKD, which is also called chronic kidney disease. And it's a chronic inflammatory state. So overall, there is less absorption of iron from the GI tract, and there is less iron reserve. So most of these patients will ultimately need therapy in the form of intravenous iron or oral iron therapy. So which actually improves the outcome, and studies have proven it. It actually improves the outcome in heart failure patients.
Right. And while we've talked about the link with anemia, Dr. Singkar, what is the connection between diabetes and heart disease?
Like hypertension, diabetes can also be a silent killer and can be a very strong risk factor for developing blockages. At the same time, diabetic patients tend to have atypical symptoms of heart disease. They can also land up with silent heart attacks, and hence diabetes is considered as a heart attack equivalent. That means someone who's been having diabetes should consider himself or herself as an equivalent of a heart disease, and they should be taking precautionary medications, lifestyle modifications, regular activities, and diet control very seriously. Not only that, they should be having regular health checks regarding heart disease, and if any heart-related abnormality is found, should be taken seriously and should be treated as early as possible.
Right. Doctors, thanks very much for joining us in that discussion and answering those very crucial questions. With that, it's a wrap on this show. We hope that it helped you learn more about cardiac arrest and means of preventing it and reviving somebody. Thanks very much for watching. Goodbye.